Hello and welcome to another episode of Clean Talk. I'm your host, Brad Whitchurch. It is 3 p.m. Eastern time on Wednesday, and that means we are coming to you live from the Seal Shield Studios in beautiful downtown Orlando, Florida. Very excited to have our guest today. Royce Brunson is the Chief Revenue Officer for Health Recovery Solutions. Royce, welcome to the show.
Thank you for having me.
Well, thanks for being here. Royce, what can you tell us about yourself and why you're on Clean Talk today?
Yeah, well, first off, I'm super excited to be here. I appreciate you guys and the invite. I really was excited to join today to talk about really two things. One, where healthcare is going. What's the future of it? I think that everybody sees healthcare from where they're standing. I stand from a unique place, being on a vendor side, a post-acute side, and kind of discussing where that's going. And I think the second thing is how technologies like the ones that we offer in our world can help infection prevention and control in the post-acute world. So that and a lot of other things we're excited to chat through today, but yeah, definitely love being here.
Well, we appreciate you being on the show. We are an infection control podcast, and we love all things technology that improve patient and practitioner outcomes. So really excited to talk to you today about remote patient monitoring and the solutions that Health Recovery Solutions offers. Tell us a little bit about the products and the offering and what you're doing in that space.
Yeah, for sure. So Health Recovery Solutions, otherwise known as short HRS, has been around for about 10 years as an organization. Really proud of the work that we've done. We work with over 350 providers across the countries. A lot of our clients are large integrated health systems, ACOs, value-based care organizations. And they really come to us with a pretty simple thesis, which is how do we help transition patients from an episode of care to home, or how do we prevent an episode of care from happening? Help us with that thesis in your technology. And so what HRS does is we deploy remote patient monitoring, what we refer to as kits. And so I always say they're about the size of a pizza box, twice as thick, and we send them directly into a patient's home. So Brad, for example, if I sure hope it doesn't happen, but if you were ever in a hospital and you were to go home and that hospital was contracted with HRS, we would make sure by the time you got home, all the equipment you would need is at your doorstep. And so essentially it's a one button, you turn it on and the whole system powers up. And the system tells you what to do, when to do it, why to do it, and how to do it over the next 30, 60, 90 days. And so we want to make it as seamless and easy for the patient and the caregivers to transition. And we want to make it seamless, easy, and integrated for the care team to transition that patient. And so we spent the better half of the last decade designing and putting in market a technology that has been rated 3 times best in class and multiple other awards and accolades in the trophy case. But it's really just for us, the important thing, the thing that we look at every week is the number of lives that we've impacted. And so to date, it's been over 400,000 lives have been on our system, and really just excited, but more so proud of the help that we've provided families and loved ones in the times of need.
Well, let's tell our audience a little bit about the specifics of what you guys do, because you're not just sending patients home with a playbook to help them adjust to leaving acute care and going home. You're actually getting diagnostic feedback, right? Can you talk a little bit about what kind of information is going back to the practitioners and how that benefits the patients and maybe the overall infection prevention outcomes?
Spot on. So for our devices that we're sending in a patient's home, that kit I was talking about, it's all customized by a patient's disease state. So a diabetic patient may have different peripherals and different education and content on our tablets than a cardiovascular patient or a cardiopulmonary patient or a new mom. It's all customized by disease state. So we have over 15 different peripherals that are available with our kits. And they will collect different vitals and biometrics along the way. And so for a hypertensive patient, it could be as simple as a scale and a BP. For a patient that may need in-home ECGs and glucometers, we can accompany that kit with that as well. And essentially, as a patient were to use the technology, and it could be the vital and biometric technology, it could be the symptom surveys, it could be the mental and behavioral health content. As they engage with the technology overall, all that data is aggregated, synthesized, trended, and then sent back to the clinical teams. And so the clinical teams on the other side can see the trends and see the data in real time. And then the system is smart enough to be able to tell the patient, or I'm sorry, to tell the clinician, if they have 100 patients, which ones to focus on and why. So perhaps they've missed their medications 3 days in a row. That's a big issue. Perhaps they haven't weighed themselves in their CHF patient and they have to do that. And so we'll actually tell them and alert them which patients to focus on and why they should do that. One of the really nice things, and one of the things we spent so much time on during COVID, is making sure that we can involve different care teams. Folks were so busy from the clinical perspective, and still are, that it's not always a luxury to have somebody just sitting there and monitoring things. So what we wanted to be able to do is perhaps that patient who's Dr. ABC's patient, maybe they get routed over that physician, whereas a patient who has a care team somewhere else can get routed one way as well. So it's really not only about ensuring there's connectivity with the care team and the patient, but also ensuring that there's convenience in the clinical workflows that are there.
Well, I love the technology. Anytime you can reduce cross-contamination by having a patient do their recovery in a remote location, certainly in the comfort of your own home, and still get the real-time diagnostic data you need to manage that patient's recovery, I think it's a fantastic step into healthcare technology for our future, and I'm sure we'll be seeing more and more of this. But help me understand. You get a big pizza box. It's not a deep dish pizza, but you open it up and inside, instead of a pizza, you've got a customized solution based on whatever your ailment, whatever your condition is. Now, are you bundling with other manufacturers' diagnostic solutions, and then you're kind of the middleware, or
Exactly.
how does it all work together? Can you explain
Exactly.
that?
Yeah. So you hit the nail on the head. So HRS has, from a software perspective, we've developed our own software that accompanies these peripherals, right? A Bluetooth scale, let's say a pulse ox and a thermometer into the home. A tablet will accompany those peripherals. And that tablet is, for lack of a better term, I say it because everybody knows it colloquially, it's the Alexa. It tells you what to do, when to do it, why to do it, and how to do it very seamlessly in an augmented way for the clinicians.
And that's your product, right? You
That's
provide
our
the
product.
tablet with your
Correct.
software that is interfacing with variable devices, right?
Correct. And so that same software is available on your iPhone, Android, tablet, or we can send the tablet in the home. So for our patients that are higher technical literacy, lower acuity, they could put it on their phone, maybe if they have one peripheral. But for the sick patients who may not have high technical literacy and you want a one button, kit to go in the home, you just push and everything powers on. We have a full service offering for that. And that's really not only about ensuring it gets to the home. Something else that we provide is all the logistics support around it. So Brad, as that kit goes from, Brad's house to Royce's house to Allison's house, how does that happen? Right? Is it a clinical team that's responsible for interacting with FedEx? No, HRS takes all that on for them. But what's important is, you had asked a little bit about where are those peripherals coming from? We partner with the leading peripheral manufacturers. So Welsh Allen, A&D, Foracare, Nonin, those really top of the food chain peripheral manufacturers and world-class ones we're partnered with in that sense. So yes, we are very much we value add the technology with our software, but then we resell it into the home. So.
Well, Royce, we're all about infection prevention here and obvious benefits to reducing cross-contaminations using this technology, but I'm going to put you on the spot here. How do you deal with sterile processing if you're repurposing these devices between different patients? Can you talk a little bit about that?
I love it, and it's been one of our hottest topics over the last few years, as you can imagine. So let's say the kit's with Brad, you're having it for 60 days. You throw your pack and slip on, it goes on your front porch, and UPS picks it up. Now what happens? So we own our own warehouses across the country. And so that kit will come back into one of our warehouses. It's barcoded and has the correct software on it. So we know exactly who it belongs to in terms of a client. And so what will end up happening is it goes into quarantine. All of our kits are quarantined for up to 4 days, depending on a few different things and where it's coming from. We use UV sterilization with the kits as well. And then based on how long a kit could be sitting on a shelf for prior to it going back out the door, it's re-sterilized. So we do have a really robust process for it. It's one that we've brought consulting teams in for to make sure it was up to speed. And so, we certainly worry about disease contamination with our kits and worry about the infection control components of it. You'd be amazed. We get kits back that have dog bones in it, that have dresses in it, that have all sorts of different things. So within our warehouses, believe it or not, we have kind of a lost and found section as a little bit of a joke for the different items that are coming back in the kits that patients may forget that the box does go off to somebody else after that as well. So.
Well, you mentioned UVC disinfection, UV light disinfection. We're big proponents of UV disinfection here on the Clean Talk podcast. Would you say that's your primary modality for disinfection, or is that a piece of? Okay, fantastic.
It's definitely primary. It's, for lack of a better term, it's quick training. It's somewhat dummy proof from our end. We have systems in place where we can not only take the peripherals out of the foam inserts, because the box itself, things aren't just thrown in. There's a really nice foam insert. We can sterilize the foam insert, sterilize everything. We've set up a nice, for lack of a better term, assembly line that goes with that. And so versus wiping things, we do wipe things down, but if you do that all the time, it certainly does start to degrade the actual equipment and the packaging that comes with it. It shortens the lifetime, and it hasn't been proven to be any less or more effective than the UV process that we use, which is awesome. So,
well, again, I love the technology from an infection prevention standpoint. Do you have any kind of data or even just a sense of the infection control impact of this remote monitoring technology? Is there any data to support what I find intuitive that this helps the problem?
Yeah, it's always from a clinical perspective, the leading question. Where's the data? Let me see the data. And so as an organization, really proud of the fact we have over 45 case studies. We have 3 nationally published case studies. A lot of those case studies are focused on some of the more obvious outcomes around readmission reduction, operational workflows, you name it, we have it. But to answer your question, Brad, really around the infection control component, we've seen some really phenomenal data outcomes when you look at especially things like wound care. When we look at patients that have had surgical procedures and they head home, what is the infection prevention, infection control measures that we have in there? We actually have a whole module built on ensuring infections don't occur within the home. And we use the cameras on the devices that have AI software built into it to be able to detect infections as they're occurring within surgical sites. So there's a lot that we can provide clients from a data perspective on that. We actually are currently conducting a study with a client that has 600 patients going home with our mobile application, which is very similar to the tablet, specifically for surgical and site infection control. And so I'm really excited about that. We're about 3/4 of the way through those patients being enrolled in there, and just always excited to try newer use cases with the technology, and especially with the AI technology that we've built into the program.
Royce, I'm sorry, but you've just blown my mind. I mean, tell me more about this AI wound inspection for infection technology. I'm not familiar with that. Can you elaborate on that?
Yeah, so it's an awesome advancement that our teams have. Our teams are always listening to what clients need from an end user perspective. And essentially, what used to happen was you'd have a cut on your hand, let's say, and you'd take a photo, and the system would capture it, but maybe the lighting wasn't great. Maybe it wasn't up close enough. Maybe there was a shadow there that impeded. You don't know what's going on with it. So there are technologies out there that you can layer in. There's apps out there now that providers can purchase. We've layered in some technology that will actually, if you go home and you take a photo of that wound, it'll create a baseline measurement of it. And then based on how it's healing, the technology will actually be able to measure certain things about it. It can measure the redness on the sides, the length of the wound, the width of the wound, all of those components of it. And some of our, which is really interesting, some of our surgical site or our surgical patients that are going home with a site will actually have a thermometer with it. And the thermometer will be able to measure if that patient obviously has a fever or an infection. So not only are we providing kind of the basic camera component, we're layering in some more advanced AI and then providing a lot of our patients with the thermometers as well.
That's fascinating. We've talked about the benefit from an infection prevention standpoint, from reducing cross-contamination exposure. What other impact, possibly for the practitioners, does remote patient monitoring provide within the healthcare field?
It's a one of those fields that's evolving, and it's evolving quickly. So I will say, if you fast forward 5 years, it's going to be really fascinating to look at kind of the world in which we stand in right now, how it evolves. And so I'll tell you a few things. First off, from a practitioner standpoint, there is still very much an element of, here's your 30-page discharge instruction packet. Here's what you're going to do, X, Y, and Z. You're sending a highly distressed, anxious patient out the doors of your organization. It could be a hospital, it could be a SNF, it could be a physician's office. And you say, Hail Mary, full of grace, I hope they're okay. There has to be technology that allows for a smooth and easy transition. And so part of it is certainly around care transitions and ensuring that the efficiency and efficacy of that is ironed out. The other piece of it is just making sure adherence happens. I mean, for so many organizations that are taking financial risk and bear large amounts of financial risk with their patients, a lot of them are hoping that an episode of care never even happens. And so how do you actually prevent an episode of care from happening? You have to be able to measure disease regression as it's happening. And so for a lot of our clients who have financial risk with their patients, they're saying, hey, this patient didn't have an episode of care, but they're at risk enough that they may come to the ED, they may be hospitalized for certain things, and we want to prevent that altogether. And so I think remote monitoring has been looked at traditionally as just a readmission prevention tool, and the second as a elderly population tool. Both of those are being turned on their head. There are patients who have the Apple Watch. We're fully integrating with that, being able to capture those type of biometrics. Let's say you're getting a knee replacement. You have to have ambulation thresholds met, right? You have to walk a certain amount before that surgery and after that surgery. Your Apple Watch is such an easy way to be able to capture that data. And that's not always a really elderly patient. That could be a 30, 40, 50, 60-year-old patient that needs that technology. So what we're talking about is making sure this technology evolves to all acuities across the whole spectrum and making sure it's applicable to everybody. I think the big thing that folks will see in the coming years is two things. The wearables are being adopted in a crazy fast way. I was on a call the other day with a health system, and the chief medical officer had two rings on. He had his wedding ring on and an Aura ring. And if you're not familiar with the Aura ring, it's a little ring you slip on, and it tracks nearly everything a Whoop or an Apple Watch would do. These companies like HRS have to be able to integrate these technologies. Why? Because lower acuity patients are wearing them. And it's not just for health benefits, it's for lifestyle benefits. How am I sleeping? What impact does drinking have on my sleep patterns or on my day-to-day patterns? How am I feeling in general? These are real questions folks are asking themselves, and there's technologies out there to be able to get it. From a high acuity standpoint, Brad, you're going to see a lot of wearable technologies like the BioIntelliSense patch or other patches out there that are being worn for 30 days or 60 days that continuously monitor patients. Imagine laying at home and I can pull up an app as a clinician and see what your resting heart rate is, how many times you've breathed in a minute, gait, ambulation, whatever it might be. I can see all that through a patch the size of a quarter now. And that's going to become really popular. It already is. So the future is here, as we say, and it's something that a lot of companies are struggling to meet that demand on. And I think that the folks that will win in these spaces are the ones that can integrate with a lot of that.
Well, let's talk a little bit more about that. And, how prevalent is this technology today? And, what is HRS's position in the market? And then you mentioned this 5-year growth projection. Can you tell us what you see in terms of the future for this technology?
Yeah, absolutely. The market itself has grown incredibly quickly, primarily because there's not always a clear distinction where things fit in digital healthcare. Let me double click on that for a second. So what is the difference between telehealth, virtual health, and remote patient monitoring? Where do the lines start and stop? It's often confusing. So let's just talk about remote monitoring in general. The market itself has grown incredibly quickly. I think that you'll see continued adoption of this technology, not only horizontally, meaning it's not just a hospital technology. Physician groups are going to adopt it. ACOs are going to adopt it. You're going to see payers adopting this. Aetna, Blue Cross, a lot of these big payers are actually already adopting this technology for their members and identifying those members that need it. And then you're going to see a lot of adoption vertically. So it's not just for the elderly patients. It's, as I said, it's for patients that are really, really young. There's actually companies in remote monitoring that focus just on pediatric patients, 2, 3, 4-year-old patients that may have asthma and other types of pediatric conditions where they need this type of technology. And I will say this, it's all about adoption by the patient, but a little bit more so than that, it's adoption by the caregivers. And so the technology itself, the technologies that are really going to make an impact are not only the, hey, Brad, hey, Allison, here's a piece of technology, you use it. It's about telling your loved ones who are part of your care recovery, whether you're compliant with the technology or not. You better believe if my mom or my dad was on a technology and I had an app that said, hey, Dad missed his medication. Dad, what's going on? We need to fix this. And so that's something that we've incorporated in our process. There's a whole separate caregiver application, but it's something that a lot of RPM companies are really developing, is kind of the engagement triangle. You have the patient, the caregiver, and the clinician all being engaged together in one process. So there's going to be evolution in a lot of different ways in the market.
I'm sure of that. Let's talk a little bit about the economics, because it's intuitive to me that this is more efficient, right? You don't have to get in your car to go see your practitioner. The practitioner doesn't have to take the time for an office visit. We've talked about the benefits from a cross-contamination standpoint, but you're shipping some expensive equipment to people in their homes. How do the economics equate? Do you have any kind of analysis on that?
Tons. And so there's a few different economic, what I would call kind of pillars to the ROI model that we have. And so a few different things. One, there's certainly when we look at the nursing shortages, when we specifically look at home health, hospice, kind of the post-acute market, we're seeing those markets be hit extremely hard by the nursing shortage that's out there today and will continue to be out there. And I shouldn't say nursing, it's provider shortage in general. And so this type of technology will certainly allow for post-acute providers to increase their census at the same amount of providers on staff. So you may not need to go to 13 to 14 to 16 to 18 providers to increase your census 20%. Because you have the technology to be able to augment a lot of that care. And so we do see a lot of providers, especially post-acute, looking at this type of technology for those purposes. That's kind of that's definitely hard dollars. But when we talk about some of the dollars that are going to be really meaningful for both post-acute as well as acute providers, we see the acute side still very focused on the readmission pieces. We look at clinical outcomes, readmission reduction, quality metrics across the board. It's really focused on that from an ROI perspective. We also see next year, a lot of folks aren't familiar with this, but it's coming whether we like it or not. Value-based purchasing for home health is here. There's been 9 pilot states for this. It is going to all 50 states next year. There is a lot of dollars at stake, and a lot of post-acute providers are not prepared for this adoption. But somebody can, get a bonus or be withheld up to 5% of their revenue. It's a lot of money when you're operating on very thin margins. So there's a lot of economics behind this that support both the hard dollar pieces and then certainly the soft components around just transitions and other components of this. One of the pieces I will say we've seen I'm proud of this, a really great adoption behind is health equity and social determinants of health. We see a lot of community health centers and FQHCs, federally qualified health centers, looking to adopt this type of technology in order to stay connected with underserved patient populations. And it's been something from an economic model perspective we can make work because we don't always have to use the same peripherals. We can use less expensive peripherals, and we can donate peripherals to these type of programs. And we can also partner with GPOs to provide really strong pricing incentives for underserved patient populations.
You mentioned readmission rates. I want to go back to that. Do you have any data on readmission rates? Because we're all hyper focused on readmission rates, whether it's the acute care facility or the insurance companies. What kind of effect does this remote patient monitoring technology have on readmission rates, and why?
It's a great question. As a company, we have over 30 case studies focused just on readmission rates. It seems to be our kind of bread and butter, sweet spot case study. It has been something that has really been the tip of the spear in terms of what folks are looking for in terms of efficacy of the programs. I could say our programs themselves have seen some very strong readmission rate reductions. We saw 64% readmission rate reduction at Michigan Medicine for their hospital at home patients, a 17% reduction in ED visits for the same program over 6 months. We've seen at places like Catholic Health up in Buffalo, we saw a 4.6% readmission rate compared to a 9% for non-RPM patients. We had Hackensack, their ACO saw 71% reduction for telehealth readmission rates versus non-telehealth. There are so many non-HRS studies out there proving the efficacy of these type of programs, because most of the time this technology is going to catch you right before something happens and somebody can intervene. Perhaps you're able to send out home health nurses. Perhaps you're able to deploy boots on the ground, or perhaps you're able to say, don't go to the ED. We have 2 open slots at your PCP today. Come into the office. And perhaps it was just a Lasix or a dietary issue that happened, and you can fix that in the moment versus having to have an ED or an acute visit at that point.
Well, those are impressive results on a critical metric. You mentioned telehealth. Can we differentiate between remote monitoring and telehealth and what the relationship is?
Yes.
Yes. So can you talk a little bit about that?
For sure. I will say that there's few things in healthcare where the Venn diagram overlaps more. There is a huge overlap with it. The way I always describe it is telehealth is typically very video focused, provider to patient focused, and focused on diagnostic visits. So, my eye is red. What is wrong with my eye, right? My stomach hurts. What's wrong with my stomach? Whereas remote monitoring is less diagnostic focused. You already have a diagnosis. We know what that diagnosis is. It's about managing the vitals and biometrics and other components of the disease as it progresses to make sure it doesn't progress and make sure it regresses. And so there is definitely a difference between those technologies. There's been an emergence, everybody knows this, of companies that fit within both buckets there. Our system does not try to be a telehealth system. It does not try to be like our friends over at Amwell or Teladoc. It does not try to impede on what those technologies are doing. They're very different. They're very integrated in different ways. Whereas ours are really meant to be a patient-first technology and a built by clinician technology for a different set of parameters. So yeah, it's funny when you join, or if you're ever to join a sales call, one of the first things we talk about is kind of where RPM sits in the market, because it's always, well, what's the difference between you and this telehealth company? It's like totally different technologies, and you're probably looking for something different if that's the comparison. So,
well, thank you for that clarification. We're all living in this COVID world. Can you talk a little bit about what kind of effect COVID has had on health recovery solutions, either from a demand side for the technologies that you have, supply chain issues? Can you talk a little bit about the impact of COVID on your business?
Yeah, the short answer is seen all the above. I'll start with the latter. Supply chain, we provide as a value-added reseller of peripherals. We've had to buy months and months in advance to avoid a lot of the supply chain shortages. We're very lucky to partner with folks that have not seen huge issues with supply chain. I'll give you an example. We work very closely with the Welsh Allen team. Very fortunate to work with them because they've stocked up so much in advance that we're able to, there's a very short lead time, about a 2-week lead time on that. Traditionally, where our business is seeing supply chain crunches is on the tablet side, because the tablet side requires such a large supply chain, from chips to all these different metals and screens and plastics put in there. And so from that perspective, we're actually been fortunate to be somewhat nimble on that side, be able to pair with different tablets. I will say that, traditionally for the last 3-4 months, what we've been doing is burning through, in a good way, because sales have been so great, burning through the inventory we have. But it does seem like a lot of our provider or a lot of our vendor partners and third-party peripheral partners are finally getting to a place where they have shorter and shorter lead times. I think if you ask them in January and February, hey, where's my BP monitor? They probably say it's on a boat in the middle of the Atlantic trying to get here. And so today warehouses are in a somewhat of a good spot. That doesn't mean prices have gone down or back to normal. Pricing and supply are correlative, but also different. Supply is in a good spot, but prices for the supply have increased. And so certainly something we've seen along the way.
Well, let's talk about the demand side. I would think that COVID would be a catalyst for this type of technology because of all the things we've been talking about. Have you seen that? Do you see more customers looking to implement these kind of solutions as a direct result of the shortage of healthcare practitioners and the greater need for separation to reduce cross-contamination risk? What are you seeing on the demand side?
Yeah, I mean, the pandemic was a huge catalyst for adoption of this type of technology. What was interesting was you didn't have to convince folks to use it. And when we talked to a lot of the largest health systems in the country, the lines were, well, we were planning on doing this in 2 years. We just have to do it now, right? Or, hey, we had a budget for this, but we axed it for, I'm making it up, a new building we were putting up. But by the way, we'll put it back in, we need it. And so there was always this, it was right there for a lot of folks. I think when we look retrospectively at the pandemic, I think a lot of health systems are evaluating or reevaluating because so many folks bought things so quickly during the pandemic. It was not a question of interoperability or integration or clinical efficacy or financial stability of a company. So what we've had a lot of conversations with health systems about is, hey, you bought this during the pandemic. You didn't buy it necessarily for COVID patients. You bought it to keep sick patients at home. Just what you said, Brett, reduce cross-contamination, keep those patients out, keep them at home where they're safe. How else can we use this now is the question that's coming up a lot. And so, we're working with a lot of our health system partners to make sure the breadth of the technology can be deployed across the enterprise. So it's not just for your 7-year-old CHF and COPD patients. It's for your 26-year-old new mom that just went home who may have had preeclampsia. It's for your 38-year-old who just happened to have, X surgery, or your 52-year-old that just happened to have a knee replacement. There are a lot of use cases for the technologies. I think what you'll see by service line, especially just from a market standpoint, is even when you double click on each service line, there's a company in there. There's a Baby Scripts is a big postpartum company. You have Force Therapeutics in the orthopedic space. So there's a lot in there that's delivering a ton of value for providers. So.
Well, Royce, you've talked a little bit about where the industry is and where it's going. In conclusion, any future predictions for HRS or this technology?
It's moving into the home. Care is moving in the home. It is incentivized to move in the home. Every major health system we talk with, we partner with 35 of the top 50 health systems in the country, have hospital to home initiatives. They want to move this care in the home. And it always starts at the top and kind of works its way down in terms of what healthcare is doing. Payers are incentivizing it. Health systems are incentivizing it. Health administrators' bonuses are being tied to it in some ways. We've talked to 3 health systems who are telling us they're changing the incentive structure to make sure patients can get home early. And so it's really, the revolution, if you want to call it that, maybe the evolution is probably a better word, is here. The question becomes, how are providers going to do this in a way that's going to meet the patient's needs? Because the reality is, and we tell clients this all the time, there's no one partner out there that can meet all your needs, right? If there was, the partner would be sitting on a beach somewhere. That's not the case. What's happening is we're seeing a lot of adoption at a service line and a patient cohort level. And it's about really, for providers, it's about really making sure they know what they're adopting, because some of these technologies can be used across them. And there are duplicative technologies within a lot of health systems and a lot of providers today. And so I would encourage anybody who's looking to adopt this technology, lean on the vendor, lean on the partner to really help analyze the market and analyze what's out there. I think for HRS, the future is bright. We've set up the technology to really go into a value-based care world. We're working with some of the largest payers in the country, providers. We're working with kind of, as we look to the right-hand side of the market size, that's where we see ourselves playing. And so the future is bright. We just have to make sure the supply chain is there, costs can be contained, and everything else. So.
Well, Royce, this is great information on fantastic emerging technology that's changing our lives for the better from a healthcare perspective. If people want to find out more about Health Recovery Solutions, where should they go?
Head over to healthrecoverysolutions.com. You can find me on LinkedIn. I'd love to connect with folks. And so I'm always active on LinkedIn. If you have any questions about this type of technology at all, I'd love to just talk from a market perspective. I'll take my HRS hat off and we could talk about all the different things that are out there to help you and your patients transition safely.
Fantastic. Royce, thank you for being on Clean Talk today. You've been watching Clean Talk, the Infection Control Podcast. Our guest today has been Royce Brunson with Health Recovery Solutions, giving us great information on remote patient monitoring. Royce, thank you for being a part of our show. Be sure to join us every Wednesday, 3 p.m. Eastern Time. You can register to be a part of our community at cleantalk.tv or see this episode or our other archival episodes on the Clean Talk YouTube channel. Until next week, I'm your host, Brad Whitchurch, reminding you to keep it clean.